The correction of malocclusions in the sagittal plane is one of the central objectives of orthodontics, as it allows the restoration of the anterior-posterior relationship between the maxilla and mandible, optimizing occlusion, masticatory function, and treatment stability. Alterations such as Class II and Class III malocclusions can manifest as dentoalveolar discrepancies or skeletal components, requiring accurate diagnostic evaluation that integrates clinical and cephalometric analysis and assessment of growth patterns. In clinical practice, the sagittal approach is based on biomechanical principles aimed at controlling anchorage and modulating forces to achieve tooth distalization or mesialization, overjet correction, and adjustment of molar and canine relationships. Likewise, decision-making depends on key clinical variables: patient age, severity of sagittal discrepancy, facial pattern, presence of dental compensations, and therapeutic objectives. Ultimately, successful correction of malocclusions in the sagittal plane is based on a comprehensive diagnosis, careful planning, and the choice of biomechanical mechanics appropriate to each clinical situation. When performed with precision, it allows functional and stable occlusal relationships to be achieved, improving both dentofacial harmony and therapeutic efficiency throughout the treatment.